We are so excited to have everyone with us today. My name is Lauren Futrell Dunaway, and I'm an assistant professor with the undergraduate nutrition program at the Wake Forest Celia Scott Weatherhead School of Public Health and Tropical Medicine. We're proud to host this webinar in partnership with the Tulane Graduate Nutrition Program. So today we are thrilled to have, I'm especially thrilled as a registered dietitian, to have 4 registered dietitians who either have background in nutrition or are public health practitioners themselves. I have a note from our administrators to give people just a minute to join, and then I will introduce our presenters. Okay, I got the go ahead. So we purposely, as a team, the Tulane Downtown Uptown Nutrition, we purposely chose people that we knew. Several of these dietitians either have an MPH or don't have an MPH, but work in a community setting. And so we wanted to give everyone a snapshot of a lot of different options in careers as dietitians, specifically with a community focus. We are going to take questions at the end. However, you can ask a question at any point in the question box, and the recorded webinar will be available at the end if you want to go back, and will be shared with anyone who pre-registered. We also have a survey link for those viewing this webinar, and it's a quick questionnaire that'll help us evaluate our work and improve future webinars. I have 2 people helping me on the back end. Kelia O'Malley is an assistant professor in the graduate nutrition program in the Weatherhead School of Public Health. She's also the associate director for the HRSA-funded Tulane MCH Nutrition Leadership Training Program and the USDA-funded Louisiana Nutrition Collaborative. And Megan Harrington is a program manager for Tulane Nutrition graduate programs and will be monitoring our chat. I am moderating today, and we're also excited this is a hybrid event. So I do have about 15, if I counted right, 14 people live here with me. So we're excited for that today. All right, here we go. I'm going to give a brief bio of each of our panelists, and then I'm going to let them fill in the details, and then we'll get started. Okay, so first I'm going to go, I have y'all in a different order, but I'm going to go in the order that you're sitting for those in the room. So Heather Nace is on the end, and Heather is a chef, which I think is so cool, and a registered dietitian and director of operations at the Goldring Center for Culinary Medicine, which is within the Tulane University School of Medicine. Heather has a strong passion for inspiring people to cook more at home, and through her work, she shows future healthcare professionals in the community how to improve their kitchen confidence. And I have a lot of undergrad students who get to work with her, so I know this for a fact. She loves teaching people that cooking nourishing meals doesn't have to be expensive, time-consuming, or stressful. She serves on the advisory board for the American College of Culinary Medicine and has helped to develop and implement culinary nutrition-focused curriculum and recipes that are used nationwide through the Health Meets Food curriculum. I added this part for everybody, specifically for those interested. Heather received her BS in Culinary Nutrition and Clinical Dietetics from Johnson & Wales, and then did a distance RD dietetic internship program. All right, we have Leah Howard, who is a double Tulane alum. Leah completed her BSPH in public health, and then actually went on to get the equivalent of a second master's to be able to apply to do her dietetic internship and MPH here at Tulane. Leah is a clinical dietitian at Manning Family Children's Hospital here in New Orleans, where she provides nutrition care to patients from diverse backgrounds. And we're excited to hear from her today about how she aims to integrate public health principles into clinical nutrition. All right, we have Kara Lubeck, who I used to get to work with when she was here at Tulane. Kara is the community nutrition manager at Second Harvest Food Bank of Greater New Orleans and Acadiana. She graduated from Boston University with an undergraduate degree in nutritional sciences, and also completed her Master of Public Health and Dietetic internship here at Tulane. Prior to her position at Second Harvest, she spent almost 7 years working in school and university food service. And last, but certainly not least, our hostess for this webinar today. So Anna Kiefer is the host because she is the instructor for this public health nutrition class. First time offered, and we're so grateful to be here. Prior to becoming an adjunct instructor with our undergraduate public health studies program, Anna was a senior registered dietitian and certified diabetes care and education specialist at Tulane University. She completed her degree in dietetics and clinical nutrition services from the University of Wisconsin-Madison and a master's of clinical dietetics and human nutrition from Grand Valley State University. Anna has really unique dietetic experience in both public health and clinical settings, and she also was a travel dietitian and has done some freelance work. So thank you all for being here today with us. I would love if you could tell our attendees today, and we'll go this way, and then I will call out for the rest of the ones. We'll let you start, Anna. Describe your work as a dietitian, including the types of projects you worked on and the communities you served. And if each of you could do about 2 minutes for each reply, and then I'll ask some follow-up questions.
Currently, or
what you have done, whatever you want to do.
Okay, yeah. So like she mentioned, so I started my career as a travel dietitian. So I was predominantly in hospitals following like acute care patients. And it allowed me to get to travel the country and work with a lot of people, grow my skill set. But it was in that time where, and I think I've told my class this, it became very evident that people coming into the hospital because of their environment and kind of felt like a bit of a Band-Aid. So I knew ultimately I wanted to get out of the hospital setting and into diabetes. During my internship, I had a rotation with a diabetes educator that was very influential on me. And so I made that transition about 4.5 years ago, first in home health and then in like a clinic setting, working alongside endocrinologists and other diabetes educators. And now I get to teach this class. It's always kind of been a dream to work my way into education. And I'm starting a role with a company called Nourish in a week or so. I want to hear what you're Okay, yeah. And they're like an online telehealth company providing medical nutrition therapy to adults.
Fantastic. Kara, can you tell us about your current role and the types of communities you serve?
Yeah.
Current for right now.
Okay. So I currently work at Second Harvest Food Bank. If you're not familiar with them, they are a huge presence in Southern Louisiana. Lots of different things that they do, but my role specifically is managing our team of nutrition educators. So in our East location, which is our one on Edwards, if you've ever been there to volunteer, I've got 2 nutrition educators, and what we do is provide nutrition education in the community. Right now, we serve 5, sometimes 6 or 7 parishes between me and my 2 team members, so we are very busy. And we do everything: taste tests, cooking demos, nutrition classes, health fairs, and predominantly honestly, we kind of go wherever anybody wants us to come. We offer it for free through assorted funding that we get internally or through grants or government funding. I also, in my role, support a few of our other initiatives, our market initiative, our senior food commodity distribution, I can't remember the acronym, our senior food box distributions, our school pantry, our backpack program, as well as doing nutrition analysis on things like senior meals, and Kid Cafe meals. And I also do telehealth part-time for Nourish.
Fantastic. Like, you want to tell us about your current role?
Yeah, so I'm a clinical dietitian at Children's Hospital, which is like right down the road off Chop near the zoo. And so I see kids all the way from like newborns to 20-year-old is pretty much like our max, from like all over the Gulf South, because it's one of the biggest children's hospitals with all the specialties and stuff. So I have a lot of kids from Mississippi, from Alabama. They like will drive 4 hours for an appointment. So I see people from like all over the place, rural Louisiana. And I do both acute care, so like on the hospital floors, and then I also 2 days a week see kids in nephrology clinics. So these are kids with renal disease. So that's like more of an outpatient setting. So I get to follow up and kind of see them like every month, longer, like more frequently. So I do a little bit of everything.
Heather, you want to tell us about your current role?
Sure. So I run the Goldring Center for Culinary Medicine. We are the teaching kitchen for the School of Medicine at Tulane. During our daytime hours, we're usually working with the med students at Tulane. We are part of their required curriculum, so they have to come in and see us before they graduate a couple of times to learn about nutrition by doing hands-on cooking classes. And then we are lucky that Tulane also supports us in doing free community cooking classes. Oftentimes, we're able to combine those two groups together. So we'll have our med students helping us out with the community classes. And then we're also lucky that we are a small team, which means that we rely a lot on our volunteers and interns. So we have, undergrad students come work with us. We have master's students working with us. A lot of them from the public health background. Well, occasionally we'll get a few other, degree programs, but usually public health is the one that's interested. And then we host Tulane dietetic interns. I don't know, all the different kinds of interns we can have. We have them there at any one time, which is really nice because it brings people from different learning perspectives and different backgrounds together, all working towards the same goal. And, for us, it's really important that we are showing people, like she said in my bio, it is about the cooking. So I definitely have a very unique job that I don't spend my days, working one-on-one with patients. I'm impacting people in a different way, and it's through the kitchen. But because we're focused on the nutrition piece, we're still getting that education in, just in a little bit of a different way.
Thank you. Okay, so my next question is, what drew you to either community nutrition or public health nutrition? For those watching and those in the room, it is unique that all of our nutrition work here at Tulane is in our School of Public Health. That nutrition looks very different. It could have a culinary focus or a food service focus. I was trained from a very clinical nutrition perspective in my undergraduate. And so I'm gonna start with you, Kara. And we're gonna pop around. What drew you to maybe the community side of things, public health, maybe not so much clinical? And for those working in clinical, kind of what drew you to kind of both? You wanna share first kind of what drew you to the community side of things?
Yeah, I guess similar to you, my undergraduate program was also very clinical heavy. And what that taught me was that was not what I wanted to do. I could definitely, I could do it if I needed to, but I was way more interested in prevention rather than treatment. Especially doing my dietetic internship, going onto some of the floors and seeing how some of the educations maybe weren't received, and worrying about if that patient was going to wind up back on the floor the next week, the next month, the next year. How can we prevent them even getting there in the first place? Which is kind of what drew me to community work in general. I also had a big food service background just from working in restaurants and managing restaurants, which drew me first to K-12 food service, then university food service, and then when things happened with my old position, I finally was like, this is a great opportunity for me to truly get into real community work. I mean, working in the schools and working in the community, or working in the university, I was impacting health in a different way. It was still community focused. But it's nice being in a public health area, seeing how this organization runs and how we're impacting health every single day and tangible outcomes.
Fantastic, thank you. Heather, I'll ask for you, what drew you to maybe the more culinary community side versus the clinical side after your training?
Yeah, so as you mentioned, I actually started my journey by going to culinary school. I was a career changer later in life and said, I'm gonna go to culinary school. I love food, I love cooking. I was personally interested in nutrition. I didn't really know what careers existed in that when I first set out to go back to school. And once I got there, I saw that I could do this degree that put culinary and nutrition together. Then they said, oh, you can be a dietitian if you do this degree. I was like, oh, that sounds pretty cool. Let me look more into that. And actually, I ended up coming down here to the Goldring Center as a senior in that undergrad program as an intern. And what drew me to the program initially was the community focus. I didn't really care that much about the med students, I'm going to be honest. I mean, the thing that drew me in was wow, I could be working, teaching community cooking classes. This is going to be so cool. And then, once I got here, I really loved the program. I loved New Orleans. And I said, hey, if you got any jobs, keep me posted. And then, yeah, one thing led to another. But over time, I really developed an appreciation for the med student side of things, especially how much we're able to bring them into the community aspect, you know. And I think but I'll never give up my love for working directly with the community. I mean, the thing that I think I like the most about it is that you have that immediate impact. You know, for me in a cooking class, for example, at the end of the class, they're saying to you, "This was so great. We learned so much. We loved that recipe," you know, and you know, or they come back the next week and say, "Oh, I gotta tell you, that tofu that we tried last week, I actually really liked it, and I went home and I made it for my family." You know, you hear that kind of stuff, and that really just, you know, fills your heart because you know that what you're doing is having a great impact on people.
Yeah, the people side of it. So Leia and I were talking before the panel. So Leia was actually a student in one of my classes when she took Introduction to Nutrition. There was no minor. She got her BSPH, went on and did the additional classes. So what was it for you that drew you to public health and dietetics, or maybe the combination of the two?
So, I mean, starting when I was like in high school, I knew I was interested in like the health space in general. I knew I didn't want to be a doctor. I was scared of blood, all of that. I'm not anymore. But I was always just kind of like interested in nutrition.
Your mom.
Yeah, I don't know, my mom's a really good cook, but also very healthy. But so I just like was always interested, and so I really wanted to go to Tulane. I knew they had a really strong public health program. I was also very interested in I did like this research paper in high school about how like environmental disasters like hurricanes and stuff can impact health, and I remember like all the research came from Tulane because of Katrina, and we had just gone through, I'm from New Jersey, so we had just gone through Hurricane Sandy. So I was like, okay, I'll do public health, and if there's some like nutrition classes, like I'd love to take those. There weren't when I was first, like freshman year, there weren't.
Yeah.
And then, yeah, so I just continued doing public health, knew I was always interested in nutrition, took any like nutrition related elective that I could. And then did the combined degree program, so did my master's in public health, and with that you can choose a concentration, so I did concentration in nutrition. And just during that time, I kind of was like, I all of a sudden, back when I was like scared of the science, I never wanted to do biochem, anatomy, any of that. I was like, I kind of want to know, like, now I know how to like kind of make health initiatives and like what programs work, how we can get like communities to make changes, but I want to be able to think of it on a more like individual level as well and really know how the body like works kind of. So I kind of did like the reverse and then went back to school, took all those classes I didn't take undergrad, so bioanatomy and stuff. Ended up loving it, and then did my dietetic internship back at Tulane, and it's a whole roundabout situation. I can talk about it more if anyone's interested.
Yeah. Do you, okay, so Anna, you told us a little bit about how you did clinical to community. Was there anything specific in terms of like courses or experiences or something that really shifted this perspective for you?
I think it was always in my undergraduate, it was something on my radar to do more public health, largely because I had a guest speaker during one of my classes who was the director of the SNAP education program of the state of Wisconsin. I emailed her after she spoke and said, "Can I intern with you?" She said yes. And she very much made an impression on me. She helped me get involved in doing research on access to farmers market throughout the state of Wisconsin, and I got to do a lot of the program development. So that was something that really like allowed me to do more of a public health role. And it's still stuff that I like consider going back to.
Mm-hmm.
I think it'll be like, yeah, kind of a back and forth opportunity for me.
Love it. Do we have any audience questions based on what they've said so far? Anything you want follow up on yet?
Well, it's this question, but it's,
You want to read it for us?
yeah,
And I can repeat
I just
it.
like how you guys determined which area of dietetics was the right fit for you and any other specialties you got to explore that you like before finding your current position.
Did everybody hear that? So kind of how did you figure out which area of dietetics was right for you? And were there any other specialty areas you were interested in before you found your own niche? Does anybody want to take that one? Maybe one or two of you?
I went into my I chose Tulane's dietetic internship program because there is a strong community focus, so I actually had rotations with everyone here. They were all my preceptors. And so like we did a second harvest one, we did 2 weeks at Gold Ring, and I really liked that Tulane's dietetic internship wasn't heavy on the clinical rotations. I was like kind of nervous to do that. Just keep an open mind because I ended up loving clinical. And I guess through, you know, kind of trying to dip your toes in as many areas as you can, because I did not think I would want to work in a hospital, but I knew I loved kids and wanted to work with kids. So that's kind of how I decided.
Fantastic. Does anybody else have something that stands out? I can move to our next.
Yeah, I was just gonna say, I did not do the Tulane dietetic internship, but I have been precepting for them for several years, and my program was very different. I did a distance program, as you mentioned, which if you guys are not familiar with that, that is where you do the work of finding your own rotation. So you have to have some connections, you have to be able to get on the phone and call people and say, hey, I need to do a clinical rotation, or hey, I need to do food service, can you precept me? It gives you some flexibility, but it did put me in a position where I didn't get to do as many things as Leia did, for example. I think, you know, it's a good thing to think about what your needs are, if this is like the road you're gonna go down. For me, I needed this because I was already working at my current job and I needed to do a program that allowed me to be part-time and have a more flexible schedule. But if you are a more traditional student, I do think a program like Tulane is a great option because there is so much diversity in what you're gonna get exposed to. And for many sites, it's a little bit of a plus minus, but for many sites, you're not there super long. So in some ways that can be great because if it is something that you're like, this is not for me, I am not like loving this, you're not there that long and you can get through it. But it, you know, then on the flip side of that, if it is something you really love, you might not be there that long, but you can always, you know, keep in touch with that preceptor, find ways to get more involved. And you can really, I think, you know, do some customization to the things that you're most interested in, right?
Like I really enjoyed sports also and was really kind of torn between, I had like a sports job lined up and then also the pediatric one lined up. And during my rotation, I was able to go back actually and do another like couple weeks or another 2 weeks actually at sports because I was like, I want to know that.
Yeah,
This
that you
is
make
something.
the decision that feels
Yeah.
right for you and you get, that's your time to explore. You're learning and exploring at the same time.
Okay, so this is a good transition question. I talk to my students about this all the time. So everyone in this room is probably interested in nutrition. Okay, you're probably here because you like nutrition as a topic. But we know that our knowledge of a topic is not what gets us jobs. Okay, either specialization or skills gets us jobs. So I'm gonna go with Anna first. Beyond nutrition knowledge, what skills do you feel like have been most valuable in your work as a dietitian in community or public health? And how do you feel like you got that more on the job or through internship or an experience like that?
I would say it's the soft skills of being able to hold a conversation with someone who might not want to be talking to you. It's not uncommon, especially, right, if you're starting off in a hospital, someone is generally very ill, they have gone through a very traumatic experience in some instances, they're vulnerable. I got my first job working at a hospital at 19, and I learned very quickly that like you can't walk into a room and be like, hi. Like you gotta figure out the person and be considerate. And so I think the skill that I've learned the most in talking to, I mean, at this point, like thousands of patients is just learning how to ask good questions and listen attentively. It's probably
Good answer, and you are very good at that.
a try.
Kara, what would you say outside of nutrition knowledge has been the skill that's been most useful to you?
Honestly, the ability to collaborate with other people. Public health is so much about collaboration. Like I think about in my role specifically, it is going out and trying to find places that want us to provide nutrition education, places that want to partner with us, word of mouth, like your ability to work with other people and then continue to work with other people to make those goals happen. We're gonna have a nutrition class, like there are things that we're gonna need from our partner agency, et cetera. I learned some of that on the job, a lot of that in public health school because everything was a group project and like coming, which like in the beginning was a nightmare for me coming from a clinical background where it was very like focused. I was like, oh my gosh, this is horrible. But by the end, I was like, this is actually fantastic. Now I know how to work with a million different types of personalities. It's great to take into any sort of job situation where you can kind of the same thing you're saying, like the ability to hold a conversation with pretty much anyone and assess like how that person wants to talk to you also helps you build those relationships and collaborate further.
So this is kind of a part B of this question. What types of organizations or professionals do you find yourself collaborating with in your current job?
Anybody that will listen to me talk. But like literally like any like neighborhood organizations, food
Okay.
pantries, schools, universities, like we are in all, like just this last week, we did classes at food pantries. We do like Roots of Music after school. We did one with the First 72, which is a prison reintegration program. We do like this is all just last week, from a domestic violence shelter. A lot of senior programming. So pretty much anyone who will listen to me, which is where that collaboration comes in because like you are dealing with all sorts of different types of personalities and also people with different goals and different motives. So like trying to assess like what is their goal of us coming in and what is our goal of coming into and how can those goals work together.
Fantastic, thank you. What would you say, Leah?
I was also gonna say interprofessional, like collaboration, because honestly, coming from the public health background, it's so true that everything is a group project. And in the clinical setting, it's kind of the same because I'm seeing a patient, but they're a group project between all the other providers. So like every day I'm talking to the social worker, if they're, if I had learned that the family has trouble accessing food, the speech language pathologists, the doctors, like the nurses, everyone, like I just came from a family meeting where it was like the full team talking to the family. And I think just having that ability to be in a group, kind of know your role, know everyone else's role, and the ability to collaborate is just really important.
Fantastic. What would you say, Heather?
So I would say for me, it's a little bit different because I am running a program and it's, a small team and we have all these volunteers. So for me, I mean, and obviously like I have to know how to cook if I'm gonna teach cooking classes, but that's besides the point. I would say, if you want to like run a program, the skills that you really need are the operational stuff, like the organization, the being able to look at that calendar and go, okay, what classes do we have? Who's coming in? What's the, all of the, being able to like, manage all of those moving parts. And it's not maybe the most glamorous sounding stuff to do, but it's worth it because that all needs to happen to make the fun part happen, which is to actually do the classes and to do the thing that we're there to do. And so I think that is what has made me successful in my role because I'm pretty good at managing all of the pieces.
You are so organized.
Thank you.
Getting
Thank you.
that calendar 2 weeks before was so helpful.
I try to be. And then, I mean, I would just to kind of go on your part B, like we also get to collaborate a lot too. And so that's really important as well. Knowing I hated group projects in school also. But it's when you're in the professional world, it's very different. And, everybody really is pulling their weight at that point. So you don't have that issue like you often do in school. But we get to do work with like the Crescent City Farmers Market, different departments of Tulane. We've done classes for public health undergrads before, again, kind of like whoever will listen, whoever asks us to do a class, and if we can make it work with budgets and timelines and things like that, then yeah, we'll do it. The more we can get our messaging out to whoever is a good thing.
Yeah. Love it. Does anybody in the audience have any questions based on what they've shared? Any questions so far? I'll keep going, okay? So this is kind of a unique panel question. And I will let you go in the kind of the order that it comes to you because I don't want to necessarily put anybody on the spot. But I think a lot of the reason that a lot of us are drawn to the public health community side of things is because we want our work to have an impact. A lot of you have shared stories about how you were drawn to this side because of that impact piece. I would love if each of you could share a specific example of a project or initiative that comes to mind that you feel had a really meaningful impact on the community that you serve or the individual that you worked with that you think the students and those listening would be interested in. I want to go first.
I can go first.
Okay.
So over the last couple of years, we did a partnership with the Center for Brain Health. They work with two main audiences. One is NFL players, mostly, retired NFL players typically with traumatic brain injury, and the other is veterans with traumatic brain injury. And so we were asked to put on cooking classes for their veterans who they bring in as a cohort and do like a whole 3-week intensive outpatient program with them. And we got to be a small part of that. And I loved getting to take what we do and just apply it to a specific population. I mean, the veterans, their attitude is just amazing. Like they've always been my favorite people to work with. They're so open to hearing what we have to say. They're already learning about the things so they get to work with a dietitian on the team to do more one-on-one counseling throughout the course of their 3 weeks. And the idea is to take what they're learning and then come into the kitchen and actually put it into practice. I got some really lovely thank you notes after certain classes from participants that just really felt like, what we were doing was really valuable to them. I really loved in the beginning, they would bring their spouses with them. So it was a good opportunity for them to cook the way they would at home. And, we got to chat with them about like, all right, who does more of the cooking? And, you just to learn and interact with people in that way. And again, what I liked about it is that it wasn't really that different from what we were doing. It was just taking it and like applying it to a different audience, which is a lot of what I do in my job. It's like the same message. Okay, we're working with kids now. Okay, we're working with veterans. Okay, we're working with college students. How do you take that and just apply it in a slightly different manner? That's been really impactful for me to work with that population.
Love hearing that. What stands out? Anna, you want to go next?
Yeah, one of the things I've done, and this is just like, I have volunteered at Covenant House for like going on 4 years now, and I teach cooking classes to unhoused teenagers and youth. And what I really love about it is that as a volunteer, I can kind of do whatever I want. And that I think is like, a good message to like remember as you like go out into the world, is that if you're under like the umbrella of like an organization, there's gonna be rules, there's gonna be like bureaucracy, but if you volunteer, you can really get a lot done. And so one of the things that was just really useful is like, I went into it with like, I just want to give them the opportunity to cook what they want. I'm not particularly focused on nutritious meals. You're living in a homeless shelter. You probably want something that tastes good, because I do know what their kitchens serve, and you hear the remarks. And the other thing that's just been very nice about it is like, as a volunteer, I feel like I've formed these bonds with them over like the crappiness of the situation. And you, instead of having to be like, oh, well, they're trying their best, you can be like, yeah, no, that sucks. And you can kind of empathize a little bit more. And even though I haven't measured like my, for a while there, I was doing like tests to see what they had learned, but I kind of threw that away. But it's just like the running into them out in the community when they've left, and the comments of like, I miss you, and like that was my favorite thing was when you came. Like that's the best part for sure.
Here, or Leanne, does something come up for y'all?
I'll say something simple. This is,
Yeah.
I was thinking a lot of stuff. It's like something that kind of along the vein of what you were just saying, something that we've been working on and putting together, and we're starting to launch with hopefully a monthly series, but we have our first one on Thursday, is cooking classes using specifically food pantry ingredients. So mostly shelf stable, really easy recipes. So repurposing a lot of the stuff that you get in a food pantry that you're maybe not sure what to do with. So the recipe that we're doing on Thursday is like canned chicken, canned beans, canned corn, canned tomatoes, like cornbread casserole type dish that we're gonna make. All of those ingredients are available in the majority of our food pantries that we serve in our emergency food pantry. They're all walking away with a bag of food to make that recipe again at home, with the emphasis on it being just like simple, easy, nutritious, tastes good, free to you at the food pantry. And that's something we've been working on. I'm really excited to get started that we're doing out of Second Harvest. And then another project that is not necessarily out of my department, but that I've collaborated on within Second Harvest. We just launched our mobile market truck, which is basically just like a grocery store on wheels, that we are able to bring to areas with food deserts. Right now, we're in Wagaman and Avondale, and it's been fantastic. My team does nutrition education, like cooking demos and taste tests and recipe cards using stuff that's on the truck every time that they're out there. And the community response has been amazing, and kind of like what they were saying, it's just so nice, like, to hear from people how excited they are, like, especially the truck itself, like Avondale and Wagaman, the nearest grocery store is so far away. They just closed the Winn-Dixie over there, so they don't really have close access to fruits, vegetables, and even just like eggs, cheese, canned vegetables at reasonable prices. And then the number of people who are taking our recipe cards and saying that our recipes are delicious and then coming back and saying they made them at home, it's just like nice and rewarding. Feels like what you're doing matters.
Yeah. Love that. I am going to, so if you are on the webinar side of things and you have a question, you can put it in the chat. I'm gonna do one more panel question and then open it up for questions in the room or on the chat, and then I have some follow-up questions if there are not audience questions. So what advice would you give to students? I'll let you start, Leah, since you just were making these decisions. What advice would you give to students interested in pursuing a career as a dietitian? And what emerging opportunities do you think they should be aware of?
I think it's tough. I think one is not that you don't need to like, I'm not saying you need to know 100% like this is what I want to do, but it is, it does require additional education. So you don't want to necessarily go into it being kind of 50-50 because it is a commitment. So like, I went back, I did more school, like took out more loans, like because I was pretty confident that this is what I wanted to do. So I think really just like during undergrad, kind of seeing what you like, if you are really more interested in like the nitty-gritty of nutrition and are like, I really want to know more of this, then like it is a good thing to consider going the dietitian route. But yeah.
I would add to I'll add to your answer
Oh,
about
yeah.
emerging opportunities. There are easier pathways now to enter the profession, so that is exciting. If you did not have an undergraduate degree in nutrition, there's exciting programs and pathways for the profession.
Yeah, they made it kind of more streamlined.
More accessible for sure.
Yes, of course.
What about you, Heather? What advice would you give to students interested in pursuing a career as a dietitian?
I agree with Leah, like you do want to have a sense that this feels like the right path for you, because it is a big investment, money and time. I think depending on what you want to do, getting that RD credential matters, depending on what you want to do.
Yeah.
I think there are definitely things that you can do without the RD credential, with having degrees in nutrition, whatever those degrees might be. But in a lot of spaces, just the fact that you have the credential gives you this like layer of credibility. It's not like, for example, in my job, I don't know that it's necessarily crucial to my job, but it is important, particularly with working with medical students, right? I think me having that added credential is important. The other thing I would say is if you do this route, just keep your options open. I mean, I clearly already had this job and it was very obvious that I was going to stay in this lane for the most part of like being a culinary dietitian. But I went into all of my rotations for my internship with an open mind that I was going to learn something. And, you know, there are so many students that I have worked with over the years who they'll say, oh, I really don't want to do clinical. I don't want to do clinical. And then come graduation time, they're all like, oh, we're doing clinical now. Or just whatever the example may be. They may have been thinking they were going to do clinical and then they did all these other opportunities and they were like, actually, I realized that this is the thing that's really calling me. And I think no matter what, don't let yourself like get stuck in one place because you're gonna have that background. You can parlay it, you know, just because you're doing clinical right now, doesn't mean you have to stay clinical. I might not stay culinary forever, who knows? You know, like you have the experience and being able to be like smart about how you can change it up, you know, going from clinical into more community, going into teaching, you know, like you have options. Which I do think that's one of the really nice things about this field is that there are a lot of options. Sometimes it could be a little overwhelming how many options there are. Don't let that scare you. Ask a lot of questions, you know, seek mentorship, you know, talk to people who seem like they know what's up and get them to help you. I mean, that's really, you gotta like put yourself out there in that way. Don't be scared or shy and don't expect that people are gonna just like hand stuff to you. You need to sort of ask for those opportunities. That's some advice I have.
Yes. So this is kind of a part, we got this question in the chat and I think it's really relevant and something, not everyone in this room, but a lot of you in this room are BSPH students. And we do, students do have to do, a capstone or internship, and obviously there's a service learning component, and then people watching the recording later at other places. What summer jobs or internships would any of you recommend if students are interested in gaining experience in this field or kind of figuring out which area of nutrition is right for them? Anybody want to take that one?
I feel like anything for
Yeah,
job stuff.
Yeah, and it's like any food.
When I was in college, I went and did WOOFing. I think I told my class this. It stands for the Worldwide Organization of Organic Farming.
It's a very funny acronym.
Yeah, and essentially like I went to France for a summer and just worked on farms in exchange for room and board, but like that looks good if you're applying to become a dietitian, like. And, you know, I've seen a lot of us like be in the food industry, whether it's like, yeah, a restaurant or working at a grocery store. If you're interested in nutrition, there's so many ways to touch that, whether it's, yeah, gardening, cooking, you know, selling food. So,
Yeah, farmer's market.
yeah.
I mean, especially in New Orleans, there are so many food-based nonprofits, like if that's specifically what you wanted to do, that offer internships, like, again, I similar to you, I did like grocery store, I worked at a restaurant, I worked at a pharmaceutical company, I worked at a women's shelter, I did a whole bunch of different things. But like New Orleans is such a fantastic place to be studying nutrition because there are so many different organizations that you could work for, but also so many different restaurants that you could work for. So like this is such a food-oriented city, no matter what aspect of food you're looking at. So like you're saying, really anything in the food industry. And a lot of these organizations like Recirculating Farm Coalition, Sprout NOLA, Market Umbrella, they all have internships all the time. So like look into those.
I have internships all the time.
There you go.
And I don't know if this is possible here in New Orleans, maybe you guys would know better than me, but when I was in my undergrad, I did a summer working as like a patient, they called it patient services.
Yeah.
Where it was like doing the meal delivery and the taking of the orders in the hospital setting. And, you know, that was not something I wanted to do as a job forever, but it was a good experience. I really got a lot of exposure in the hospital that when I then went in to do my clinical stuff, it wasn't scary because I had already been in that world a little bit.
Did you seek it out as a job or was it part of a course requirement?
I did, they basically had it available as sort of like a paid internship.
Okay.
So a summer job. I didn't need it for credit. I just said, hey, I want to do this and get some experience so that I have it on my resume. And it worked out really well for me. And I was actually working with a really interesting, diverse combination of people too in that role, because that job is like you know, it's not a very high paying job, it's a pretty entry level kind of role, so there were people working with me from just a diverse background, which was really cool, but like there were some other nutrition students, and then there were all these like local people, and I don't know, and they were really teaching me, you know, people without even a, you know, probably with like a high school degree were like teaching me so much because they had been doing that job for years. It was great. I mean, it was a really good experience.
I know a lot of people are interested in clinical internships, which are harder to come by because dietetic
Yeah.
internships do exist. But I do know a lot of dietitians locally who have unpaid, paid internships or are looking for people with like social media help or who have let people shadow them. So there's always kinds of
That would be
opportunities.
another thing, like recommendations for people who are not like thinking about going into nutrition. There are a lot of dietitians in New Orleans that work in a lot of different fields, like.
Yeah.
Reach out to them on LinkedIn, Instagram, and just see if you can meet them and talk to them about what they do, because you might not be sure if nutrition is for you, but then you learn what one person does that's completely sort of out of the box, and you're like, actually, maybe it is for me because I really like that.
Yeah, absolutely. What about one of our audience questions? What questions do y'all have?
Well, this is more for Leia, because I've also been thinking about acute clinical work, because I think working with kids is really amazing. But you said you worked in hospitals, but also, is it like one-on-ones with specific cases or conditions? What would a
Yeah,
day
so-
like look like?
Basically, so Children's Hospital is like an all-in-one, so there's like the acute care floors, which is the typical like what you see on TV when you're admitted, you're in the hospital room. And then there's also clinics, so like a GI office, a dentist office, cardiology, like all the specialist doctors, they're just all also like located in the hospital. So I didn't, this is kind of, I mean, I didn't have any like specific background in this, but I'm actually in the nephrology clinic, so it's all kids with end-stage renal disease, and I see them before and after they get a kidney transplant, which is surprisingly a lot more kids than you even realize. Like we have like 10 kids in clinic every Monday, Tuesday morning, like all the time. So I'm able to see them, so I get to like talk to them for a longer amount of time, which is nice because like I can form relationships with them, with their parents. I can actually follow up on if I recommend that they, make this change, add this in. At next visit, I can be like, so did we do this? And can kind of really see. So I like that part of it. But I also like the acute care.
Doing that, are you talking more to the kids or the parents or both?
It depends. For the older kids, I'm talking to them because they're usually the ones, and this is also where like my public health background kind of comes in, because there's a lot of different factors that affect why people eat, why people think certain things, why they behave certain ways, like, social, cultural, economic, all the things. So you're kind of like an investigator. You're finding out, like, you're not just like, why aren't you eating your fruits and vegetables? It's like, what grocery store do you go to? Oh, it's 30 minutes away. Okay. So you're only buying salted canned beans because that's what keeps in your fridge. What if we tried this? You know what I mean? So it's, you kind of have to dig a bit. But I'm talking to usually parents when it's young kids.
Right.
Also, a lot of my kids have different developmental disabilities, so a lot of the time, it really is the parent that is fully managing their health. So like I have a lot of kids that are on tube feeds, stuff like that. So that's less public health and more very clinical. Except for when it comes to like getting social work involved and stuff like that. But yeah. So
And it depends on the setting. So like I did my internship at a really big clinical, like Vanderbilt Medical Center. So like for pediatrics, they had a huge pediatric team. So they had like inpatient dietitians and then outpatient dietitians who work like Leah, either with like nephrology or diabetes or cardiology. I know the pediatric dietitians who work at Ochsner Children's here are graduates of our program. They see everything. Like they're in an outpatient clinic, so they could see somebody in the same day, they could see somebody for like 10 different diagnoses.
Yeah.
So there's a lot of variability depending on the hospital you work with and how they have their inpatient, outpatient.
there's 11
setup.
of us in my office. So like one dietitian is exclusively outpatient GI. One kind of sees just general, all different kinds, like kids with feeding issues, food aversion, stuff like that. We have one that just does kids on dialysis, and then there's also the inpatient one. So I see also like everything inpatient. I see new diabetes diagnosis. I see a lot of kids that come in super undernourished for various reasons. Something as simple as like kids having RSV, still have to go see them, find out they have other like nutrition related things going on. So yeah, there's really like a lot of different opportunities to see a bunch of different things.
So we have another question from the chat online, and I really appreciate this question because I think we all experience career pivots. Even after finishing a dietetic internship and becoming an RD, if you're still unsure about what to specialize in, what would you recommend doing?
Like in terms of, are we talking like
Like
community,
jobs,
clinical,
yeah. Or, like,
food
how would you
service, or
figure out
like
which one
more
to do?
niche than that?
Get a job and see if you
I mean,
So what I heard you said, just
I get a job and see if you like it. I've
Get a
been in
job
3
and see
different,
if
I
you
did
like it.
K-12 nutrition, like K-12 school nutrition. I did university food service, and now I work as community nutrition manager for Second Harvest, but I also do telehealth part-time, which I thought I would never do because I didn't like clinical, but I really like it now. Things change also.
Yeah.
It's like nutrition is constantly changing and the jobs are constantly changing, and like, honestly, get a job, and if you hate it, stay for a year.
Yeah.
yeah. I mean, I think there's so much less stigma nowadays
Yeah.
in like moving around a bit. I don't think you should job hop like every
No,
couple
no,
of months, but like, yeah, your advice of like commit for a year,
Yeah.
give
As long
yourself
as
a year, like work on the next thing while you're giving it that year. But yeah, I mean, you don't need to feel like it's your forever job.
Yeah.
The advice that is commonly given is to get like a general clinical position, but I would add to that, if you know you don't wanna be in clinical, then that's probably not a good fit for you.
That was me.
So-
Right.
That's, everyone was like, well, just get a hospital job, and I was like, I don't want to do that. And
Yeah.
so I'm not going
Yeah.
to.
People say that because there's almost always positions
Yes,
available.
It's true.
You know, you
Might
could
be.
take an entry level dietitian at those places, so it is true. But I don't recommend doing that.
If that's not what you want to
absolutely,
do.
yeah.
All right, we have time for one more audience question, or if any other come in the chat. What questions do y'all have? Yeah.
I guess I was wondering about like, just in like your daily lives outside of work, how is nutrition like part of your life?
That's
Does
a
it
great
ever,
question.
like become like consuming, or like how do you find a balance with that?
Fantastic question.
Really good question. I'll start. For me, I personally have found that being a dietitian can go 2 ways, really. It can, I think, better your relationship with food, and I think it can really harm your relationship with food. So I think having to be aware of the kind of person that you are, and also being food into those things. For me, I have found that like, I'm a very like all foods fit, food freedom kind of person, and I really live that way. And so for me, it's great that where it becomes hard in my personal life is you will get so many questions from like, and it is like I have a friend who used to say you would never ask a dentist to like do a root canal for free. But people have no problem asking you a million questions, and if you give them the answer that they don't want to hear, they then tell you why you're wrong. And it's having to like, I'm
We're laughing because it's true.
It's like, it's having to learn how to kind of just be like, yeah, like I've been a dietitian for almost 8 years now, and so it's like learning to just like, I don't need to fix, when you first become a dietitian, you want everyone to like, it's almost like an imposter syndrome of like, I want everyone to know that I'm the expert, I know what I'm
Yeah.
talking about. I am now in a place of like, you're not paying me for this information anyway. But it can be, so like knowing the kind of person that you are, if you can be a kind of obsessive person, it can become all consuming.
Yeah, I would say for me, I have changed so much in my time of like before going to undergrad to now in just what I know and what I believe about nutrition. I was so much more rigid with the way I approached food nutrition before I went to school. And I think moving here probably benefited me in a lot of ways to be less rigid, but you know, I'm definitely of the same mindset that Kara is. You know, I feel like we don't need to be perfect, you know, there's room for everything. And I'm always number one, first and foremost, you know, because I have the chef background, I want the food to taste good.
Yeah.
I would say for me, I don't talk to people outside of work about nutrition a lot. Like I really don't. I mean, I feel like I have other hobbies and interests. I don't, you know, I don't consume a ton of nutrition outside of work because it has as much as it started as a passion for me, it is now my work. And so I don't want to be so all consumed by it. I want to have some other things that I can like focus my energy and time on and, you know, brain power. And I don't want to be obsessive about it at all. I feel like I want to just approach it from a more, you know, neutral place. I also feel like I will admit, like, when I'm busy and crazy, I am like the typical like healthcare provider who like takes care of everybody else, but like doesn't take care of myself properly because that's just the reality of life. And I mean, it makes teaching my classes really helpful because I'm like, look, we're the same. Like, I'm gonna stand up here and tell you all this stuff. Am I always doing it? No, because it's real life and it's hard, but you know, I feel like that's just because I'm always busy. Maybe if I was less busy, I would be better at following my own advice.
Great, that was a great question. Well, we are going to wrap up for our official webinar piece of this. I have a few quick announcements. So thank you so much to our panelists, our sponsors, and Tulane Downtown Nutrition and our participants for joining us today. We do have for those joining on Zoom or those in the room, there is a really exciting, there's another exciting webinar this week that is part of National Nutrition Month. And it's called Nourishing Beginnings Perinatal Nutrition and Support. It's on Thursday from 1 to 2 on Zoom. And if you are, we can post that on Canvas sites for those here. And so it's a partnership between the Southern Center for Maternal Health Equity and the Tulane Nutrition Leadership Training Program. And they are going to welcome Stephanie Marshall, who's the Executive Director of DePaul Community Health Centers, and Tyra Gross, who's the Associate Professor and Head of Public Health Sciences at Xavier University of Louisiana, to share their work and research on the social determinants of that are affecting maternal health, breastfeeding, and perinatal services. Stephanie Marshall will present hearing her during WIC visits, addressing social determinants of health during women, infant, and children program visits. And Dr. Tyra Gross will present her research on the role of work as social determinants of Black maternal health from Louisiana PRAMS. So we also have some exciting things going on here locally at Tulane. We have our nutrition book club, if you're interested in being part of that or reading The Wellness Trap by Christy Harrison. They also have a newly launched nutrition resource library that you can check books out from. So this is a quick reminder that the archived webinar will be available after the end of today's session and will be shared with all who pre-registered for today's event by email. And if everyone could take a moment to complete the short but important questionnaire that was shared through the link in the chat box, and we'll get that out to y'all who are here in the room with us. That'll help us evaluate our work and improve future webinars. So thank you again for joining us today. We'll give a round of applause for and everyone, I hope you have a wonderful week. If you're in the room, hold on.